So good afternoon, and we're very excited today to continue our weekly wellness program on our Sundays, which continues to have more and more people that are participating. But today, as part of Heart Month, we've had the added benefit of including hands-only CPR training for our community. And you never know when you're going to need to perform this. And last night I was at an event, and I was speaking with some people and learned that one of the people was a survivor of a heart attack, and his wife was able to do CPR and save his life. So remember that learning how to do this can save a life, and we're really excited to be bringing this to our community, and we will continue to be doing this at least once a year to try to make sure that our community is well prepared in case of an emergency.
Sadly, there are about 300,000 out-of-hospital cardiac arrests that happen annually. Back in the day when I first became a CPR instructor, stood up in front of the class and taught people to push on the mannequin, and sadly not a lot of people survived. The success rate was about 5%. Now, depending on the community that you live in, some communities have a 50% success rate. I am the Director of Emergency Medical Services in the City of East Providence, and we hover right around 15 to 20%, depending on the year. And a lot of that success rate depends on people like you, people that are just lay rescuers, maybe the loved one of somebody that goes into cardiac arrest, and somebody that's willing to get involved and hopefully help save a life. So when you guys are coming in, I heard a lot of people say, you know, CPR changes all the time. Blame Amanda from the Heart Association. However, it does. It changes basically every 5 years based on science. So as technology improves and science improves and more evidence becomes available, things change. The best thing to come about with CPR recently is the advent of compression-only or hands-only CPR, which is what we're going to learn today. Basically, most of the time people don't want to get involved in giving CPR because they don't want to breathe in somebody's mouth. So nowadays, it's perfectly permissible to just push on the center of their chest, hard and fast, and call 911. So if you don't remember anything I say today, if you find somebody that you don't think is breathing and we can't wake them up, all you need to do is call 911 and then push hard and fast in the center of their chest, okay? So if you've taken a CPR class in the past, there was a lot of emphasis on where do you place your hands, you know, and a lot of that has gone away. We still want to try and get them in a close spot. I want to show you where that is. But basically, if you can only remember those two things, if it doesn't look like they're breathing, call 911 and then stop pushing. They push you away? Stop pushing. They didn't need CPR, okay? So we'll rewind a little bit. So cardiac arrest is when somebody is not breathing and their heart is not beating, okay? That is cardiac arrest. The papers that you have in your hand describe a heart attack. Many, many, many people have a heart attack that does not lead to cardiac arrest. However, sometimes when people do have a cardiac event, such as a heart attack, they will go into cardiac arrest. So that's why we want to try and recognize the signs and symptoms, call 911 right away and get them in the hospital. That way, then if they do go into cardiac arrest, they're in the best place for that, okay? Whether that be in the ambulance or in the hospital. So, I said we need to make sure that it looks like the person is not breathing. If you've ever seen anybody in cardiac arrest, they do not look like you and I look. They just look lifeless. They look ashen gray, and they're just lifeless. So basically, if we see somebody and we say, hey, you okay? Are you okay? And they don't wake up, and it doesn't look like they're breathing normally. And the reason why I say breathing normally is sometimes when people are in cardiac arrest, they have what is called agonal respirations, and it almost looks like a fish, like kind of like a fish out of water with a respiration every now and again, but there's no rhyme or reason to it, and there's no chest rise. So if you look at them and their chest isn't rising and you can't wake them, call 911 and stop pushing, okay? So if you've taken a CPR in the class in the past, you might say, well, what about checking for a pulse? For lay rescuers, they say it's perfectly fine for you not to check for a pulse. Because if I was your loved one and you were to check for my pulse, you want me to have a pulse, right? So a lot of times what happens is people spend a lot of time waiting to feel a pulse that's not there. So a couple things before we actually start pushing. There's nothing really clean about CPR. You know, oftentimes we cut the clothing away. Oftentimes there's body fluids involved. However, this is the only chance that these people have to live. So if you don't get involved, if we do nothing, they will die. Getting involved and doing something gives them their best chance of survival. So essentially, all we need to do is say, are you okay? Are you okay? Doesn't look like they're breathing. In a room such as this, or nowadays, what's everybody have on them? Cell phone or two, right? You can call 911. Get help coming right away. We'll talk a couple minutes about an AED. So if you're in a building like this that probably has an AED, we want to try and bring that to the patient's side as well, okay? So essentially, wake them up. They don't wake up, doesn't look like they're breathing. Find where their nipples are in the center of their chest and just push hard and fast. And we're pushing to the tune of what? Does anybody know the song?
Staying alive.
Staying alive, exactly. So we want to push at least 2 inches, and we want to be pushing at least 100 times a minute, okay? So if you can think of that staying alive in your head, that's how fast we want to be pushing, okay? Exactly. You want to skip the first part, though. The first I was afraid. You know, you want to jump right into it. You know, get right to the heart of it. Get to the disco days. So, you know, a lot of people ask the question, will I break somebody's ribs? The younger the patient is, the least or less chance we have of breaking their ribs. As they get older and their bones become more brittle, you do run the risk of breaking ribs. However, that's why we have doctors. They can fix broken ribs. They can't fix dead, okay? So don't worry about breaking somebody's ribs. Really, don't worry about pushing too hard. It takes a lot of force, and you're gonna all get up and practice. It takes a lot of force. So really try and push from your shoulders. You know, if you try and push from your elbows, it's tough, but if you can get your upper body over the patient, and push like this. The other thing you need to try and do is let the chest fully recoil, which is easy at the beginning, but as you become tired, what do you want to do? You want to lean. Well, if I just keep leaning like this, I don't let its heart fill back up with blood, okay? So that's the most important part. Push hard, push fast, let the chest fully recoil. If you watch TV, a lot of times it looks like it's a jump starter. Well, what an AED does is it takes your heart that's beating too fast, it's shaking like this, but it can't pump blood, and it stops it. It stops it in hopes that when it clicks back on, if it clicks back on, that it'll come on in an organized rhythm that will be able to pump blood. So, in order to use an AED, you need to get the patient's clothing off their chest. So this has to have direct skin contact. So, you know, class full of women, they always ask, what about a bra? As long as it's not underneath the pads, okay? And like I said, there's no modesty when it comes to CPR. A lot of times, the clothing gets cut off, and it is what it is, in order to save somebody's life. So, pretty much every AED on the market is designed with 1 or 2 button operation. So this one, as soon as you open the cover, there's an on-off button. This one does function a little bit differently because it's a trainer. And if you forget everything I've said, the AED talks to you. And in addition to talking to you, it has pictures on the case to tell you exactly what to do.
Unit okay. Stay calm. Check responsiveness. Call for help. Stay calm. Check responsiveness.
The biggest thing you can do in an emergency is stay calm. If you've heard this a bunch of times, it's told you to stay calm.